Assalamualaikum warahmatullahi wabarakatuh. We are from Group 5 and today we would like to present about our budget report on behalf of our ministry, which is Ministry of Health. Ministry of Health is a main government agency that in charge of all that related to public health. And its objective is to assist an individual to achieving and maintaining certain level of health status in leading a productive lifestyle.
My name is Satifah Huria. I will be explaining further about the Ministry of Health. As for the vision, it is for a nation to working together for a better health. For the mission, it is to facilitate and support the people to attain fully their potential in health, appreciate health as a valuable asset, take individual responsibility and a positive action for the health. Second, to ensure a high-quality system that is customer-centered, equitable, affordable, efficient, technologically appropriate, environmentally adaptable, and also innovative.
My name is Aimanada. I will continue with Outcome-Based Budgeting System or OBB. OBB is a comprehensive method for converting planning into result through effective policy and program implementation of public fund. It is a strategic management tool designed under the Strategy Reform Initiative (SRI). The budget is a central tool through which development results and priorities are realized. So with OBB, results are measured at nearly every project stage, including input application activity completion, output delivery, and impact achievement. The objective of OBB is to provide structural mechanism to translate policy and concept of NTP to outcome and result. The second one is to empower controlling officers to manage resources under their control. The third one is to increase accountability at all levels through strengthening of governance framework. And the last one is to ensure the government will achieve the concept of value for money for budget expenditure management.
There are 8 principles of designing outcome-based budgeting system, which is the first one is planning and constructing a budget based on the program-based approach. Second one is roles and responsibility of the Ministry of Finance, Economic Planning Unit, and Public Service Department. This is my name, Ministry Budget. Third one is ministry program aligned to the National Result Framework. The fourth principle consists of a medium-term perspective in planning a budget. Fifth is to strengthen performance management. Sixth is empowering controlling officer. Next is the incentive for result achievement, and the last principle is continuous skill development.
For the overview, the Community as Specialist Program is a program that is being held by the Ministry of Health for the community, especially that lives in rural areas with the difficulties in getting treatments from the respective specialists. This program is conducted periodically as the specialists will visit the rural areas for 3 days in each month. Before the specialists went to the rural areas, the Ministry of Health will monitor what type of disease is impacted the community so that they will send the right specialists in helping the community in fighting the disease. This program is focusing in Perak as there are numbers of rural community or the Orang Asli community that are not being exposed to the outside world and to the advancement of the medical technology. As for the objective of the program, one of the objectives that need to be achieved is to ensure the community in rural areas receive the amount of treatment needed. This is because in rural area, the health treatment are not as advanced as in urban areas. So the rural communities need to travel to the urban areas or to the city to seek the specialists for further medical treatment. With this program, we can leave the burden of the rural community to travel far into the cities just to seek the medical treatment, as this program will provide the specialists for them. Next, this program is to decrease the number of infected people in rural areas. This can be seen as the number of people that are infected by the various diseases in rural areas is higher compared to in the urban areas. Some of the rural areas also have a rare disease that might not have in the urban areas, so the medical care in the rural areas are limited. So, with this program, the Ministry of Health can make observations in rural areas about the disease that are often experienced by the residents of that place and send the respective specialists to the respective places. Next is the output of the program. The output of a Ministry of Health program with a regular health specialist visit to a rural community may encompass several outputs. Some of the output are health education and awareness, disease surveillance and management, healthcare access improvement, community empowerment, health infrastructure development by upgraded or newly established health facilities contributing to the overall healthcare infrastructures of the community, data collection and analysis, and also community engagement by the active involvement of the community members in health-related activities, fostering a sense of ownership and also a collaboration. As for the outcome of the program, first of all, residents will have a better access to healthcare service, which will contribute to a more equitable distribution of medical resources. Increased access of immunization and preventive measures can result in a significant decrease in the number of cases of transmissible illness in the population. Furthermore, the program is expected to increase the community members' health awareness, equipping them with knowledge about the preventive health practices. As a result, a culture of proactive health management is established. Regular health checkups and consultations allow an early detection and intervention of any health conditions, and increasing general well-being. The execution of the Ministry of Health program involving regular visits of rural community can have far-reaching and long-lasting effect on both the government and the society. From a government point of view, the program can help to produce a healthy population, resulting in reduced long-term healthcare costs. The government can reduce illness recurrence by focusing on preventive care and early intervention, resulting in lower healthcare expenditures and more efficient resources allocations. Long-term advantages may also include a reduction in the load of healthcare infrastructure, as proactive community wellness efforts can reduce the needs for acute medical interventions.
Moving on, now we're looking at the second program that will be conducted by the Ministry of Health, which is the Women Cancer Free campaign. This campaign is mainly focused on women in Terengganu because according to statistics of the year of 2023, the number of cancer patients increased, including breast cancer and cervical cancer. Although most cancer are genetic, we as the Ministry of Health want to implement this campaign to provide an early awareness to women. Besides, during this campaign, the Ministry of Health will be collaborating with 43 local clinics in Terengganu. This campaign will be held twice a year. Lastly, after calculating all the expenses that might be used during this campaign, the Ministry of Health will allocate the budget as much as Rm 5 million. This budget will include all the costs needed.
This program is an awareness program that focuses more on women in Malaysia, since there are high statistics of women who suffer from cancer, mostly cervical and breast cancer. So this program is an effort or initiative of the Ministry of Health Malaysia to educate the public, especially women, about cancer through a country involving the community. This program also uses the medical staff, and it also includes volunteerism concept. This program added volunteerism concept is because the number of available medical staff are decreasing, especially in rural areas, making the delivery of health information cannot be covered completely and comprehensively. Among the activities that will be implemented in this program are talking about how to prevent cancer, the way to detect cancer at an early stage, and medical checkup, such as urine and blood tests to detect cancer. This program will be held every 6 months, means that twice times in a year at 43 government local clinics, focusing on 7 districts in Terengganu. This program also focuses on women that are between 18 and 65 years old, because this category of ages normally has the high risk of having this cancer. Among the initiative in promoting this program is we've made an advertising on all available social media platform. Hence, we also use television and radio platform in promoting this program, since it can be seen as one of the effective platforms in promoting the program, because it seems to have the ability to reach a large audience. We hope that with the occurrence of this program can help to increase awareness in the community and can reduce these two types of cancer from increasing, since the main aim of this program is to inform and educate the community about the two dangerous cancer towards women, which are breast and cervical cancer. In other words, this program can help our country reduce the number of people who are suffering from cancer at the chronic level and raise awareness about the two types of cancer that are mostly suffered by women in Malaysia.
For the outcome of this program, we are hoping to achieve the increasing in the rate of healthy women. It is important for women to ensure that they are always in their best condition of health. So, this program is one of the initiatives to reduce the number of breast and cervical cancer patients in upcoming years in Terengganu. Besides, the outcome is to give free checkups and preliminary tests to women in the hope that there will be more local people will show up for this program. The third outcome is to ensure that women who are diagnosed with cancer can get an early treatment such as operation and chemotherapy. Hence, the result of this initiative campaign is that we expect that it will give more awareness about cancer. For the outcome of this program, we are hoping to achieve the increasing in the rate of healthy women. It is important for women to ensure that they are always in their best condition of health. So, this program is one of the initiatives to reduce the number of breast and cervical cancer patients in upcoming years. Next, the first impact of this program is reduce the number of breast and cervical cancer patients in Terengganu. We hope that this campaign can help to open the eyes of local women to not be afraid to go for the checkups and take a test to find out whether they have a symptoms of cancer or not. As a healthcare center, we are welcoming with an open heart for any women who come for a screening test. The second impact of this campaign is to encourage women to do a regular health checks at least twice a year. By doing these checkups, it helps in preventing women from being infected, which may lead to the chronic stage. And lastly, there will be no cure. Next, the first impact of this program is reduce the number of breast and cervical cancer patients in Terengganu. We hope that this campaign can help to open the eyes of local women to not be afraid to go for the checkups and take a test to find out whether.
The third program that will be held is Road to a Healthy Life. It aims to encourage Malaysian community to be engaged in physical activities to fight obesity. This program is open specifically to 200 participants from states with high obesity rate, namely Melaka and Negeri Sembilan. The Ministry of Health will collaborate with experts in the field of health such as My Health under MOH and certified weight loss trainer. To add on, other than just doing daily exercise, this program will also hold several special activities weekly, which are Zumba and hiking. Estimated budget to implement this program is 1 million, which include payment of event props, weight loss trainer, and others. In this third program, there are 3 main activities will be conducted within a month. The first one is 30 days challenge. Participants will engage in some doable physical activities and they will be put on a diet program to learn how to improve their eating habits. Participants will be guided by a certified weight loss coach, which is Kevin Zari. They will be conducted online, where participants can follow the program as and when, wherever convenient for them. Participant and coach also can communicate with each other via Telegram or WhatsApp. The second activity is Zumba. It will be conducted on the first 2 Saturdays of the month at an open area at Bukit Serunding, Melaka. The third activity is hiking. It will be organized on the last 2 Saturdays of the same month at Bukit Melati, Negeri Sembilan, which have fairly flat hiking trail. For these last activities, the participant will be guided and monitored by another certified trainer and instructor, which is Coach Rizwan. Other than that, the top management of the Public Health Department under MOH will also participate to support this program. In terms of participation, this program is limited to 200 participants from Melaka and Negeri Sembilan. Participant Body Mass Index BMI must above 25, which categorized as overweight, obese, and very obese. Participant must be from the age of 13 to 65 years old. As for the objective of the program, it is to reduce obesity rate in Malaysia, secondly, to introduce to society the importance of a healthy lifestyle, and at the same time raise public awareness of the danger of obesity. Lastly, to increase the unity of Malaysians who are made up from different racial, ethnic, and religious backgrounds. For the process of the program, there are 4 methods will be used to promote this program. The first one, through official social media such as Instagram and KKM website. The second one is radio station. The third one is TV station. And the last one, through billboard advertisement. For coaches selection, there are some criteria that the ministry look in selecting the best coaches. Some of them are the coaches must be certified, have vast experience in the field of coaching, can create various health training methods, and so on. As for the output, the ministry expects by the end of this program, it can increase awareness and knowledge of the danger of obesity among participants so they can make improvement in their eating habits and sedentary lifestyle. Next outcome of the program. Through this program, the participant may be able to develop a consistency in building a healthy lifestyle within a month. Secondly, 50% of the participants will succeed to lose at least 10 kg of body weight or even pass the obese range. Lastly, to increase the unity among participants who are made up from various ages, races, and religions. Moving on to the impacts of the program. In long term, the ministry can successfully reduce obesity rate in Malaysia. Prediction of 41% of Malaysians will be obese by 2035 can be opposite. To progress, Malaysia can become an obesity-free country. The second impact is it can spark an idea to establish a Department of Health and Nutrition courses in the Ministry of Health. And last one, it could be a turning point for the government to make changes in improving the policy related to obesity, such as imposing tax and enacting the Malaysian Anti-Obesity Law.
As for the budget for the Community as Specialist program, we are being allocated for a 4 million. This budget is being divided based on the emolument, cost of tangible asset, other expenses, and cost of maintenance. As for the emolument, Ministry of Health will provide the staff and the volunteers hotel for 3 days for each month. Thanks for the cost of tangible asset, we will be providing mammogram machines, blood smear test kit, blood test kit, health equipment, urine analysis test, and also CT scan, which is in the range of 3 millions, and other expenses like the canopies, tables, and chairs for the people, and also the cost of maintenance for the laptops and equipment for the clinics in the rural areas. So the total is 4,013,400 ringgit.
Moving on to the budget. First, for emolument, we have two categories that we must pay allowance for, which is the staff and volunteer. We will provide RM200 for each staff for every local clinics in Terengganu. Meanwhile, for the volunteers, we will pay RM100 for each of them. And the budget for the food after the program, we will provide RM10 ringgit for each of them. For the cost of tangible asset, we have provided enough budget for the mammogram machine, pap smear test kit, blood test kit, and the health equipment.
The allocation of budget for advertising and promotion of this program is 600,000 ringgit. The advertising includes social media, television, and radio. Other expenses of this program were 595,000 ringgit, and for the cost of maintenance of this program is worth 200,000 ringgit, making the total allocation for this program worth 4,603,918 ringgit.
To continue, the statement next to me is the total budget allocation for the third program, Road to a Healthy Life. There are several descriptions that the ministry has looked into, such as emolument, advertising promotion, cost of maintenance and services, other expenses, and cost of tangible asset. For emolument, it was divided into two, which are allowance for staff under MOH department and both coaches that the ministry will appoint. The second one is advertising promotion, which will be done through radio station, TV station, and billboard advertisement. It can be seen that the budget is distributed more on this advertising promotion, which the total is 632,000 ringgit Malaysia. Beside that is the cost of maintenance and services. Some of the items that need to be maintained, including all systems in the Ministry of Health official social media platform, office desktop, speakers, and microphones. The fourth description is other expenses, which consists of food and mineral water and banner for both Zumba and hiking program, consolation prize for both coaches, table and chairs, and canopies. And the last one is cost of tangible asset, which consists of first aid kit. After calculating all of this description, the total budget allocation that the ministry get for the third program is 931,500 ringgit Malaysia.
As for the conclusion, the budget allocation for the Ministry of Health is the largest compared to the other ministries. The budget allocation will be used for the health facility to cope with the cancer and disease. Some of the programs that can be organized by the Ministry of Health are the Community as Specialist program, Women Free Cancer program, and Road to Healthy Lifestyle. This program can be organized by the Ministry of Health in order to ensure the community living in a healthy lifestyle. Plus, the ministry can help the community, especially the women's societies, to fight the disease or the cancer in an early stage to reduce the rate of the cancer patients.